going ahead to record. And we are live. Hello, everyone. Thank you so much for joining. If it's okay with you, Monica, I'll briefly introduce myself and kick it over to your team at the Center for Early Childhood Education um, to roll in to introduce our wonderful speaker and very own clinician for today. So it's good to meet you all on behalf of UCR Health. My name is Eileen, and I am joined by a wonderful pediatrician and wonderful human being, Dr. Roopa Viraraghavan. And
Everyone.
she is so amazing. I know we can't help but sing her praises. And very soon, if this is your first session and you're joining future sessions as we go forward in this 4-month series. We hope that you'll discover just why we love her so much. Um, because she loves our community and most importantly, our youngest community members. So, with that, I'm very delighted to be partnering with Monica and the wonderful staff here at CC. Monica, do you want to go ahead and introduce yourself?
Yes, hello. So I'm Monica. I am an administrative assistant here at CC's North Building. So I work here in the North Building, but I also have my fair share in the South Building. I work directly under Dr. Davina Bailey, who's our executive director here at the center. In the chat, in the video as well, or in the Zoom call, we have also our associate program director, Miss Lisa Martin. And then we also have our program director, Miss Kimberly Pixley, who is not here at the moment. And then our enrollment coordinator is also on this call, Miss Ani Velasquez. So I will let Miss Lisa introduce a little bit about herself before we continue.
There, I had to make sure I unmuted myself. Hello, good evening. Thank you everyone who has joined us. My name is Julissa Martin. I'm the Associate Program Director for both North and South Center. I have taught everything here at the center from infants all the way through kindergarten. I've been in the field of early childhood education for 28 years, but I've been here with UCR CC for 15 years. And I'm actually going to be graduating soon in May as an educational therapist. So that's it. Thank you.
Well, with that, Dr. Rupa, I
Okay,
would love for you to get started. Kick
all
us off
right.
here.
Thank you so much, everyone. And what a pleasure it is to give a talk on behalf of pediatrics at UCR Health. And so happy to be partnering with Cece. And this topic today is one of several topics that we're going to be doing on a monthly series. And this one is flu season, what you need to know, common colds versus allergies. So overview, if you guys would like, you can leave your camera on if possible. It makes it very interactive, but it's not necessary. So I'm going to give you an overview of what this talk is. And it's going to start with the UCR Health video so you can see a little bit about what we do at UCR Health, a little bit about my background, and follow that with giving you guys the objectives and the guiding questions. And then what I'm going to do is send you into the breakout rooms where you'll introduce yourselves and do one question at a time and come back from the breakout and answer the question. One of you can designate a parent speaker, and then we'll go over the answers. And then after we've done these 8 guiding questions, we should come close to the end of the hour, and we'll do our conclusions and thanks, answer any further questions, and then talk about upcoming events, and then give you the link for the Survey Monkey. So I'm going to click on the video. Take me to the video first, but I'm going to stop the share and reshare the video. Tell me if you can hear.
Welcome to UCR Health. We see our mission in action every day. Through a dedicated team of physicians and healthcare professionals, our unique care delivery model has revolutionized and redefined what it means to serve Riverside and Coachella Valley, because we are inland Southern California. Quality care, it means different things to each of us, but it's at the core of what we do. We're teaching the best and the brightest how to heal, educate, and empower those we serve. It means delivering high-quality primary and specialty care at the right place at the right time. Because we are UC Riverside Health. Because this is our community. Because we are healing the Inland Empire. And we all have a role to play in keeping our community healthy right now and into the future. We care together and improve lives together, because health starts with you and with me.
It's caring for your little one as if they're our own. It's training the next generation of physicians to take care of our community.
It's knowing I've helped a generation of community members.
It's helping a grandmother's heart beat stronger than ever.
It's making your body yours again.
It's caring for your mind with my whole heart.
It's showing the diverse faces of our community they are not alone.
Because health starts here. Because health starts here.
I am UCR Health.
मैं UCR Health हूँ.
Yo soy UCR Health.
And together, we are UCR Health. Join us, because health starts here.
What an inspirational video. I'm going to go back into my PowerPoint. Right. So a little bit about me. I am a pediatrician, glorified pediatrician, Peds ID doc, and a professor here at UCR School of Medicine. And I have affiliations with Eisenhower, RCH, Parkview, and Corona Regional. And I'm based at Citrus Towers here at UCR Health. My philosophy is that I should always maintain my composure and be clear-headed to make sound medical decisions and prioritize comfort, kindness, and compassion for children and families. So the goals are these key topics for the questions and objectives today. We're going to do flu season overview, understanding the common cold, recognizing the flu, differentiating between colds and allergies, managing colds and flu symptoms, preventing colds, flu, and allergies, when do you consult a pediatrician, and give you some good references and trusted sources. So the first question is, what is the impact of flu season on children? And understanding the flu season, learn how flu season affects children's health and daily life. So what I'm going to do now is send you guys into the breakout room. How many participants do we have?
Total of 11.
Okay, so I'm going to create maybe 3 breakout rooms. So 4 to 5 is a nice number. Go. And I'm sending everyone into the room and all of our parents who are also with CC and UCR Health.
I can go ahead and get started.
Sure.
I was in a great breakout session with Summer Mayfield and Maggie. In that session, we spoke about how both Maggie and I are working parents, and I am about to, hopefully soon, enroll my infant into one of the CC classrooms in the next month. A little bit anxious about her getting the flu, but Maggie reassured me that it gets better over time.
So, what do you think the impact of the flu season is on children?
Really tough. I just see her sniffling and sad and crying and just uncomfortable all the time. So it's tough for us to, as a new mom, it's really hard for me to imagine her going through any pain or struggle.
Since no one else has anything to say, I'm just going to go on to the answer. So, flu season affects millions of children, and there are many missed school days and medical visits. And there are some misconceptions that they have overlapping symptoms, but they do require different treatments with respect to cold, flu, and allergies. Recognize the symptoms early will help us prevent complications. So this is our next question. So what causes the common cold and how is it treated? So what you're gonna break out and answer are, what is the cause? Tell me some symptoms or some treatments and designate a parent volunteer. And I'm gonna send you guys, now that you know the format. Was there too much time, too little time? What do you guys think?
I thought it was quite a bit of time, Dr. Rupa. Maybe we shorten it.
Okay,
Maybe we shorten it up a little.
Okay, I'll shorten it to, we did 3 minutes total time, so I'm gonna shorten it to 2 minutes total time.
Okay. I'll go ahead and speak for my group. So we discussed that it's through it's a viral, it's through virus, through the mucous membrane, either by touching your eyes, nose, hands. So that's how you get it. And how it's treated is by plenty of rest, hydration, making sure you're covering your coughs with your elbow and washing your hands.
Awesome. And how about some symptoms?
Oh, sneezing, clear, runny nose,
Okay.
and maybe some cough.
Okay.
Maybe.
That's a fantastic response. I think you got almost everything, if not everything. And so those are the causes, primarily rhinovirus, over 200 viral strains that lead to colds. And common symptoms are, as you said, sneezing, runny nose, sore throat, mild fatigue, some low-grade fever. And treatment is all about prevention, rest and hydration. Use some saline, some humidifiers, help ease the symptoms. So that's good. And here's Dr. Osei, one of our lovely pediatricians. So let's go on to the third question. How can you recognize flu symptoms in children? Now that we have the handle, I'm going to make it of this. I think this was a good amount of time. Was it enough, guys?
Yes.
Okay, so let's do 2 minutes then total. So 1.5 minutes in there and half a minute to come back. How do you recognize flu symptoms in children? Recognizing the flu. What are the key flu symptoms? Understand when medical intervention is needed. Okay. I'm going to send you. It's like everybody's back. So one of you guys designate a person to answer. And let's move on. What are key flu symptoms? And any of the other parents that are off camera are most welcome to speak. You can stay off camera too, whatever you guys prefer.
Nobody?
Okay, I guess I can go for our group. This is Maggie Godinez.
Thank you.
You're welcome. What we were discussing was that it's more of an infection, and the signs are a little bit more clear, since I mean, it comes with a fever, temperature, and also the mucus is not clear. It's more of a color mucus, due to the infection.
Okay, awesome. Let me give you the answers. So flu, as you know, is caused by influenza, and you do have high fevers. You have chills and headaches, muscle aches, sore throat, and fatigue is like a well-known player in the symptoms. And treatment is antiviral medications for the high-risk group of patients, if it is prescribed. Otherwise, rest and fluids help the recovery. Good. Let's go on to our next question. How do you tell the difference between a cold and an allergies? This is an important parent question because then you won't over-medicate your kid. And so this is an important one that we want to learn to avoid misdiagnosing our kid and mistreating them, because many times we're doing our own home treatment. So I'm going to send you guys in. And here we go. It looks like almost everybody's in, so let's get to the answers. I would love to have someone be designated to speak and tell me what's the difference.
Okay, I'll go ahead and speak. We believe that the differences with the cold, you get like the some temperature, you may have the cough, perhaps a little bit of a body ache, versus the allergies, you don't get those symptoms. It'll just be the clear nasal drip, perhaps a little scratchy throat and itchy eyes.
I think you hit the nail on the head.
Yay!
Let me show you. Nice. This is one of my patients here. Yeah. And they have if they have a cold, they'll have thick yellow-green discharge. And if they have an allergy, it's clear and watery. So you got that very important one. And then the difference is all that itch, the itching of the allergy, eyes, nose, and throat. Cold, it's rare. But one thing, allergy symptoms seem to persist for a while. Cold symptoms are shorter. It's really important to separate out that cold symptoms are shorter. And sometimes these allergy symptoms, if they're a little longer, we don't want to label them, oh, it's a sinus infection, because you have other symptoms. So to help us not be over consuming antibiotics or requesting them, you can tease apart the symptoms even if they're longer. So that's a really important slide, I think, today.
Yes.
Because it'll help save our kids unnecessary treatments. All right, let's go into the next one. How can cold and flu symptoms be managed effectively? How do you relieve these symptoms at home? So I'm going to send you guys into the group. Flu symptoms management. How do you relieve these symptoms at home? Anybody like to pop in their answer? Please unmute and speak. You don't have to come off camera.
Sure, I'll go
Okay,
ahead.
I'll say something.
Go ahead.
Oh, no, you go. You can go.
Okay. I was like, Rachel and I both felt the pressure.
Oh, no.
I was going to say at
No
home,
pressure. No pressure. No pressure. No pressure.
we use steam, sometimes like steam from the showers to do if they're having a lot of issues with cough, maybe honey or those are kind of, I would say, or then like other like homeopathic kind of more natural medicines
Sounds
that
awesome.
you can buy over the counter.
That's fantastic. And anyone have to say anything about flu? Anything more about that?
We had mentioned doing a cool rag if they have a fever, but a lot of hydration and rest.
Yeah, cool rags are awesome. Try to make sure that they're lukewarm rags, because then you don't drop your kid's temperature down too fast. So lukewarm measures are always better than the very cold rag. Let me share the next answer slide. There we go. So you guys nailed it, rest and hydration. They're the big things. They're what are speeding up our recovery, because these kids get dehydrated, and that's what gets them into trouble because of the insensible water loss. So we want them to be hydrated. That's where you really have to work hard. And then all these naturopathic stuff, that's the way to go. So saline, the honey, those are all things, the humidifiers, the long steamy showers, aromatherapy with some eucalyptus oil. Those are all things that seem to make a big difference for symptom relief. And then you can use a fever reducer. Once you hit 101.5, you feel pretty miserable. And so that's when you bring out the Tylenol. Then you do the cooling measures. You do it like maybe 30 minutes apart. And then if that doesn't work, then you can go on to ibuprofen. But I can't say it enough before pediatricians start getting on our soapbox and saying, don't take aspirin. We used to see Reye syndrome. We don't see that hardly anymore. So that is a metabolic dysregulation that happens from aspirin in children. So leave it for Grandma Betty, but never for baby Betty. All right. What is the best way to prevent colds, flu, and allergies? You guys are like rocking it now. So I'm going to send you into the chat room for about a minute, because you've now become breakout room pros. So let me send you there, and you can answer this one. And I'm going to make it 1 minute. Everybody is almost back. I think that's everybody, right? So I'm going to go now into the question. Let's have anybody unmute and tell us, what is the best way to prevent?
Anybody? Okay, I'll go. We rest, washing hands, staying away so to prevent contamination, staying home, rest, staying on top of your immunizations and vaccines. And if you need medication for your allergies, make sure that you're taking it during allergy season. Vitamins.
Okay.
That's
Guys
it.
That's a lot. Thank you. Let's go. So here, hand hygiene. That's the thing, because almost everything will be killed that way. And it will, the mechanical movement as well as the washing is what reduces the spread. And push come to shove, if you don't have the quick and easy washing hands facility, use some sanitizer. But some of the viruses, like enterovirus, need the hot water to clean them off. So it's good to do the hand washing if you can, but try to get as much of it with the sanitizer if possible. And then flu shots help lower the risk of severe illness. There are subgroups of patients that they really get a huge benefit from having severe disease. And then allergen-free, like having less carpeting, more wood floors, less curtains, more kind of synthetic kind of covers. That seems to help prevent allergies. Dust covering your bed, dust covering your mattress, dust covering your pillow. Those all seem to make a difference in terms of like not having to take a lot of extra medications. And there's several preventive allergy medications now that work through just local use, intranasal, and not having to take orals, and talk to your doc about that. So vaccine recommendations are really critical in protecting vulnerable populations during the respiratory viral season, and adhering to these guidelines will reduce the burden of disease, not only flu, but COVID and RSV. And talk to your doctor about these things, should be interested. Okay, I'm now going to give the easy questions. When this is like the very important severe symptoms, when do you have to go see the doc? You must go. And that's the next question. I'm going to send you into the breakout room. And it probably applies for almost all super sick patients, not just pediatrics, not just flu. So here we go. So, okay, guys, I think most of you are back. So when do you consult a pediatrician? When is it severe? And happy for anyone to respond.
Okay, I'll go. This is Summer.
Hi, Summer. Thank you.
No problem. Number one, if the fever is really high and you're not able to get it to come down,
yeah,
definitely would be a reason to go. I mentioned in our group, something that I use at home with my family, my children, is the oxygen reader that you place on your finger.
Oh, fantastic.
So because a lot of times children, when they're playing and stuff like that, they might not know that they're not passing oxygen correctly or not enough of it. And that's a big trigger of when to rush your child to the hospital.
I love that you said that, Summer, because in pediatrics, we call the pulse ox the fifth vital sign. And the pandemic made a flood of very inexpensive pulse oxes come onto the market. So you can get them from anywhere from $20-25. And for a baby, you put it on their big toe. And for everyone else, you can put it on their second finger. And so that really is anything above 95%, you can relax. And so that's great. And then the high fever, that's awesome. And any other, so airway, breathing, circulation is always what gets immediate medical attention. So respiratory distress, that's the thing. Always anything that has to do with airway, breathing, circulation, those are things that bring you right back to the doctor. And so you answered the big ones. So fever above 103. A breathing difficulty, the pulse ox would have picked up if you're having breathing difficulty. And so they're rapidly moving, they have a severe cough or symptoms that last more than 10 days. That's always something that should bring you to the doctor because they are, maybe they're picking up a sinus or a pneumonia at that time. All right, that was a great response. All right, let's go on to the next one. And so this is a very simple answer, so I'm going to put you in there for 30 seconds this time. What are the reliable sources of information? Please don't say TikTok. Like everyone is almost back. So thanks for your patience, everyone. You guys are like superstars answering all my questions, and I'm so grateful for the active participation. You've been like wonderful. This is the last one. What do you guys think are some good, reliable sources for information? Do you have any ideas at all?
It's not TikTok, Roopa, but Dr. V. Or Dr. V or Dr. Roopa. Should we call you Dr. Roopa?
You can call me either or. I love it.
It's not TikTok, but it's close. It's a cousin. I use ChatGPT.
Yeah.
And I don't know if that's bad or good, but it works.
You know, as long as you read the references that go with it. So I think that if you have like good references that associated, that then you're doing well. It's good for medical literature because it's picking up a lot of the important references. So I'm good with that one because we all use it because it also picks up CDC, healthychildren.org, which is a wonderful AAP resource. And it has a parent channel. It's awesome. And then the American Academy of Pediatrics, which has a lot of good info. You can go and put your request of info in the search engine there. And Healthy Children is so nicely written. This talk is from Healthy Children, by the way. I abstracted their website so that it was parent friendly. And so it's like our main source. So let's stop here and you guys take a stretch. And if you're driving, please don't take a stretch. And I figured this was a great time for parents as they're driving home with their kids from school. And so I was hoping that 4 o'clock session timing would work for everyone. And I hope that you've been entertained. And I thank you so much for your attention. Nothing like a yawning baby to feel good about the world. And I thank Cece for the invitation. I thank Eileen Kwan, UCR Health, for the slide content review and technical expertise. I thank Monica De Dios, CC, for the slide content review and technical expertise. And I'm happy to answer any questions.
And while we're waiting for questions, Monica, did you want to drop the survey link also in the chat? Excellent.
I did have a question.
Yes.
Hi. So about the fever, is it different in infants versus children?
Yes, that's a great question. So what pediatricians use is the 3-month cutoff. So under 3 months, children are pretty fragile and their immune system is not able to mount a full immune response. So we use this number 100.4, which is the low end of the fever spectrum, 38.1 as our cutoff. So under 3 months, we're so worried about their temperatures that we do a rectal temperature. But many times when there's a small baby that has a temperature, it's overbundling. So you unbundle them first, see if they cool off, and then you do a rectal temp. Because so many times people who have been told that they have a fever, the baby really didn't have a fever. So that's that's the age of cutoff. Over 3 months, you can use a digital thermometer under the armpit and add one. Or you can use all the fancy ones out there. But I stick with the simple one because it's never breaks, especially when we are worried about our kids. You want a working thing. So that's my way of checking the temp. So that's a great question. Thank you so much.
And I'm sorry, what was the number again for over 3 months?
So under 3 months is 100.4. You must react to it. It's like an intense amount of reaction. Blood cultures, urine cultures, nose swabs. Under 1 month, it's lumbar puncture. So a lot of reaction. Over 3 months, 102, 102.5, that's when you start getting a real fever. And but you can usually tell from your kid what is going on. Sometimes they will have they'll have a runny nose with that temperature. They'll have a cough. Sometimes they'll say that I have pain when I go to the bathroom. They'll tell you. Many of them will tell you, and parents know what's going on. Any other questions in the chat, Eileen?
Not that I can see of, but please feel free to go ahead and drop them in.
Dr. V.
Yes.
Allergy season, is it October through March?
So seasonal allergies depend on when the pollen count is highest. And that depends on what part of the country you're at.
Okay.
So people have different types of seasonal allergies. Sometimes they're to molds, sometimes they're to grass, sometimes they're to trees, sometimes they're to dogs and cats. All of these can give you seasonal allergies. Depends on the kid, what their allergic to, but grass is often a well-known seasonal allergy, and it's springtime that we often see a lot of symptoms because then the grass cutting is starting and the
Okay.
grass is growing. So that's that time, and the trees are starting to bloom. So that's when the pollen count is higher. So
Okay.
that's when we see some of the kids with their symptoms.
Okay. Thank you.
These are all awesome questions. I'm so happy to answer them.
Dr. Roopa, if I may.
Yeah.
I think that's a wonderful segue into reminder that the Google form is now dropped in the chat, and there is an opportunity for you to also drop in questions for Dr. Rupa through that survey. So thank you so much, Monica, for pulling that together. We also want to take this opportunity to share on the UCR Health side that Dr. Rupa is accepting new patients. So we always welcome any of our community members, those who are tuning in even after this session is completed via a recording on the website or on social media. We welcome you all to give us a call at our 800 number and schedule an appointment with Dr. Rupa. You can also find us at ucrhealth.org.
Can we also drop the talk into the chat for the families so that they can read it at their leisure if they wish?
I believe we can. This is the Google presentation.
Yes. So if you guys, if families are interested in getting the presentation sent to them directly, just please fill out the survey and then your email will be requested, and then we can send it off to you guys. We will also be posting these on Moment Path or on our website as well for these notes.
And Eileen, where will the video recording be posted?
Great question. We will be posting it in a number of places, so you can access it through social media, but all of the videos will be hosted, at least on the UCR Health site, on our YouTube channel, and you can find us at UCR Health.
Thank you. And here's a friendly reminder of our monthly series that's coming up. And I'll try to make it as interactive as possible so that you guys get the most out of it.
Well, thank you so much, Dr. Rupa. Thank you so much, CC. It has been a pleasure to kick off this series, and we look forward, Dr. Rupa, to your next talk on developmental milestones from infant to preschool. That will be on March 26th, also on a Wednesday at 4 p.m. So see you all there. Thank you.
Thanks everyone.
Thank you.